Okay, I see the mayor has joined us and he is currently connecting to audio. So while that process is happening, good afternoon to everyone. And we are going to go back to the format that we had been previously using, where we have the mayor's remarks in English and then questions in English, and then the mayor's remarks in Spanish, and then questions in Spanish. And this afternoon, we also have with us Deputy Mayor Jennifer Moon. A lot of you have had questions regarding the dashboard that is online at the new normal page at miamidade.gov. So she'll be here to answer some of those questions if you have those. Now, Mayor Carlos Gimenez, out to you. Mayor, you're muted still.
Well, okay, let me
There we go.
Am I unmuted now?
No, I can hear you.
Okay, good. All right. Good afternoon, Patty.
Good afternoon.
Good afternoon, everybody. I've been seeing a lot of media reports this weekend about a spike in COVID-19 cases in Florida, and I want to, have this presser to set the record straight. First, as I've said from the start, with more testing, we will see more positive results. But having more positives does not mean that people are severely ill. Right now, testing in Florida by both the state and the private providers is the highest ever. The percent of positives for COVID-19 in Miami-Dade County remains relatively stable. When you look at the daily dashboard that we post on miamidade.gov, you'll see that our 14-day average is at 7.8%, and that's under our 10% goal as recommended by the CDC. Back when you go back to March, when testing started, up to today, the average is 9.3%. And today, we're testing anybody who wants a COVID-19 test and is over 12 years of age. From the very beginning of monitoring this virus, I have said that what we have to watch very carefully is hospitalizations. Those are holding steady despite a big push to test all high-risk groups and expand testing overall. That includes patients and workers at nursing homes and assisted living facilities, our first responders, the jails, and our homeless population. We're seeing a slight uptick in hospitalization, and that's because patients at nursing homes are being sent to hospitals and are treated quickly. Although today we have 607 patients in hospitals, exactly the same number that we had back on June 1st. We have plenty of hospital capacity for regular beds, ICU beds, and ventilators. We have thousands of empty hospital beds. We have hundreds of empty ICU beds, and we have hundreds of empty ventilators. When you check our medical examiner's office for the daily COVID numbers, you'll see that the number of deaths on average continues to drop. At this point in time, we do not see any kind of big spike. What we do see is more people working and doing the things that they want to do, like going to the gym or going out to the park or the beach. But all of those places, we have very stringent rules to make sure that there's social distancing, people wear their masks, and that they don't congregate in groups of more than 10 people. Now, obviously, we've had protests and other gatherings the past few weeks that made social distancing challenging. But even in those situations, you can see that most people were wearing masks. Plus, they were outside in the heat and fresh air, where public health experts tell us the transmission of the virus is more difficult. We're not going back to closing our economy because numbers inch up over a couple of days. What we're going to continue to do is to strictly enforce the rules and continue to watch the guiding statistics carefully. And that means continuing to check businesses to make sure that they're complying with capacity limits. We will continue to check on parks and beaches to make sure people are wearing masks when they should and that they are always practicing social distancing. And if you see a person or business that's not following the rules, we want you to call 305-4-POLICE. That's 305, the number 4, and then police. We also want to remind everybody that the county's Safer at Home order has never been lifted. If you are in a high-risk group, you should make every effort to stay at home as much as possible. This applies to people older than 60 or those who have certain medical conditions like an autoimmune disease, a respiratory condition, or diabetes. Even as we started opening up businesses at 50% capacity in this yellow phase of the new normal, we are seeing strong compliance of the rules. We will continue to monitor this, and if we see a true spike over a 14-day period, we will do what we have to do to change course. But for now, we're heading in the right direction. We need everyone to take personal responsibility, follow the rules. That's the best way to keep us on track. I'll take your questions in English before saying a few words in Spanish and answering questions in Spanish. Patty, what do we have?
We're starting off this afternoon, Mayor, with CBS 4's Hank Tester. Hank?
Hank?
I saw him. Hank Tester, are you there? Okay, I see him there, but he's not unmuted and his camera's not on, so we'll move on and wait for him to come back on later. Andy Slater, Fox Sports Radio, you there?
Yes, I'm here. Earlier today, just a couple hours ago, Mayor Suarez said he has major concerns about COVID-19 in Miami. Do you share those same thoughts, Mayor? Do you have major concerns?
I always have concerns about COVID-19. Never know what this virus is going to do. We're not ready to say that we're going to be closing down our economy. That's the last thing I want to do. The first thing we want to do as we continue to see spikes, and if we continue to see spiking in these numbers, and remember, it's the percentage of positive. It's really not the number of people that we see. Obviously, the more people you test, the more people you're going to have positive. And so what we look at is the hospitalizations, and that's been fairly steady. What we look at is ICU, the use of ICUs has been fairly steady. What we see is fairly steady use of ventilators. We have a large capacity here to handle more patients. And so that I am not overly concerned, but we are watchful and we will continue to watch it. And we will make more efforts to enforce the rules. I have gone out on a couple of occasions. I've seen at least one or two of the stores I've been that maybe they're not following the rules like they should. Today at the morning meeting with my directors, I emphasized, especially the police department, who've been pretty busy the last couple of weeks, that, hey, we need to go back out, start enforcing rules to make sure that it doesn't continue to creep up. There's been a slight uptick, but not something that I'm overly concerned about at this point. That could change in the next days or so as we see more and more evidence of either a trend or maybe as a hiccup.
Lastly, he said that he spoke to you today. What was that conversation like? What did you guys talk about?
Well, he told me that he was concerned about it and that he wasn't going to do a stay-at-home order, and I was happy he didn't do that because that would be it would be very confusing to the people of Miami-Dade County, the city of Miami doing a stay-at-home order and the rest of the county being open. So, I'm glad he did that. We need to continue to talk about what he's seeing. Well, he sees the same things we do. As a matter of fact, he sees what we produce. And so he may be coming up to different conclusions than we do, but we've been at this for a while. We produced all these reports. My deputy mayor and I, we speak all the time about what it means. And there's reasons why things happen that he may not be aware of. Like I know that speaking to the governor yesterday, they've made a concerted effort to start testing down in South Dade, the migrant farms. But we do think that there is a significant problem down there. We haven't seen an uptick in hospitalizations down there, but we do see that there's probably a much higher incidence of positives among migrants because the way that they work, also the way that they live together, than the general population. And so we've got to check into that and see if that's what caused some of this uptick in the last 2 out of the last 3 days. We've had a hiccup sandwiched with a normal day. So we need to look at it. We need to look behind the numbers to see what the causes are.
Thank you, Mayor. Out now to Ben Konark with the Herald. Ben, are you there?
Yeah, thanks. Can you hear me?
Yes.
Thank you so much. It's actually just leading on that topic you were just commenting on there. What are you seeing? Because I know, Mayor Suarez mentioned the 18 to 35 age group. Could you tell us anything additionally about what you're seeing in the demographics of these new cases?
I really can't tell you much about the demographics of the new cases. The 18 to 35 is not a group that is overly concerning at this point with this virus. It's the people that are over 60 years old and also the people that are with underlying health conditions. I would assume, and we expected, that if people did not follow rules, and younger people tend not to because they feel that this is not a serious issue for them, that you would see an uptick in that group. And so we're going to get behind the numbers and see if that's the cause. The problem with that is if you get an uptick in that group is that when they go home or they visit their parents or their grandparents, then they may pass the virus on to them. So that's why we're telling people that are over 60 years old, also the ones that have an underlying medical condition, to be more careful. They're the ones that, we have safer at home guidelines. They are definitely safer at home. You need to stay at home as much as possible, especially if you have an underlying medical condition.
Thanks. And just one quick follow-up. When we're talking about migrant farm workers, do you have any sense of what proportion of the new cases they account for, or how many cases you're finding in those communities?
No, a lot of this is, look, we see the data, and then we start to ask questions. And so another question that I asked today was the use of remdesivir, which is a antiviral drug that was under testing in Arizona, and it appears that we're using it here in Miami-Dade. Well, in that case, when you take remdesivir, you have to stay in the hospital for 5 days. Well, how many of those that are staying now in the hospital for 5 days would have been released back home because they had very mild symptoms? Remember, a lot of people, most of the people here are not in the hospital that have had COVID-19. As a matter of fact, the vast majority have never been in the hospital. They either have no symptoms or very light symptoms. The people in the hospital has been pretty consistent, hovering around 600. Sometimes it goes above 600, sometimes it goes below 600, but about 600. And like I said in my opening statement, on June 1st, we had 607 people in the hospital for COVID-19. Today, we have 607 people in the hospital for COVID-19. And so that's really what I look for. Not so many how many people are positive, although we look at the positive rate, but how many people actually are getting hospitalized because of this disease.
Thank you, Mayor.
Appreciate it.
Now to NBC6, Connie Fossey.
Hi, Mayor. I have a question regarding to patients admitted into hospitals. We're seeing an increase of COVID patients admitted into hospitals. 76 reported Saturday, 61 on Friday is the highest two-day total in a month. So while the hospital capacity is stable now, what do those numbers suggest about the future, and do you have any concerns about that?
When you have 2 days of data, look, this is a long-term issue, and we've had hiccups with data, and so sometimes it could be that those patients that are being admitted come from nursing homes where they found a problem, and then they admit them into the hospital. So Jennifer, didn't we have like a 20 or so patients the last day or so come in from nursing homes? Jennifer.
Yes, sir. Just from 2 specific nursing homes with teen transfer.
You're kind of breaking up. So can you say that again?
Just from 2 specific nursing homes, we had 14 transfers.
So again, you have to go behind the scenes and look at what the numbers mean. Just the raw numbers really can't tell you the whole story. And different days mean different things, because different things are happening. Again, we look at it and we look at the hospitalizations, and it's been pretty steady. It's 607. Same thing as it was on June 1st. It goes up, it goes down. Same thing with the use of ventilators. It goes up, it goes down. I think we're using right now, we have 57 people on ventilators. We're at the high, we had about 140 people on ventilators. So that's what we're looking at. Also, the number of deaths on average has gone down, and that trend continues. So, we keep a close eye on this. That's why we have this dashboard.
When do you think, you talked about we shouldn't be looking into a 2-day trend. When is a good period for you to look at, and when you should be concerned looking at these particular numbers?
Oh, well, it should be more like a week, okay? And then does that trend continue for over a week? We had some spikes after Mother's Day. We saw a spike in cases after Mother's Day. Well, now it's 2 weeks since the beginning of the protest, all right, in Miami-Dade, 3 weeks after Memorial Day. So does that have something to do with it? We also have been opening more. And so we frankly expected more cases after we opened, without a doubt, okay? But because we know everybody's not going to be following all the rules. And so it's contingent on us to enforce the rules as very strictly, and that we're not kidding, because we don't want this to get out of hand. And so, all those are probably factors. And if you see an uptick in, a percent or two, that's probably all of those factors, are factored in, or we're factoring all those factors in the fact that some numbers may be going up. But again, the hospitalization number is pretty steady.
Mayor, my last question. Jackson hospitals have seen the largest percentage increase since April when it comes to inpatients. Is that because once again, the virus is spreading, or is it a matter that now all inpatients are being tested, and obviously with elective procedures, now they're discovering that they have the virus? What is your take on that?
Yeah, I spoke to Carlos Migoya from Jackson, and he said that all patients are now being tested, and what they're finding is folks that are coming in with elective surgery that are there for some other reason and have absolutely no symptoms whatsoever of COVID-19. When they're tested, they come up positive. I think he had something, his number was like 20 of those, the cases that he has now are actually those kind of folks that weren't in our numbers before. Now they're in the numbers. And so that causes an uptick too.
Thank you, Mayor.
You're welcome.
Thank you. CBS 4's Hank Tester, are you there now? Still no? Okay. Let's go out now to Local 10's Christina Vasquez. Christina?
There. Hi, can you at least hear me?
Yes.
Yeah, we can hear you.
Okay, perfect. For some reason, my video is not working. You know, when it comes to enforcement, when it came to the city of Miami, the police department within the city of Miami actually created a compliance task force. And it was broken down even into industry, and they double checked with certain companies. As far as I last checked, Miami-Dade County Police's approach has been more on, we will check for compliance within our routine patrols. At this point, and such a delicate point in the reopening, as you're monitoring this uptick in cases, do you have any plans to ask Miami-Dade County Police Director to actually create a designated task force to really be focused solely on compliance?
We have our police officers, you know, some days have done 12,000 inspections. Okay, I doubt any police department in this county has done as many as we have. Our focus since the beginning has been on compliance, not only with the police department, with our inspectors. And so, you know, I leave it up to our director to follow through with that directive every day. And we have a staff meeting just about every day. He tells me the number of inspections that they've done and the compliance numbers, which are really, really high. Okay, so today I emphasized again to him. He's been kind of busy the last couple of weeks with other things, like every other police, you know, the City of Miami Police Department has been, and Miami-Dade, that we're going to be refocusing our efforts on compliance. And so he knows that, and so his officers will be out tomorrow, as well as our inspectors out tomorrow to make sure that the businesses and the people of Miami-Dade are complying with his rules. Again, look, at the end of the day, we have to take personal responsibility. It's not just up to government to try to, make this work. It's up to each one of us to have personal responsibility, to assume that everybody is infected, including yourself, and protect yourself and others by wearing masks and maintaining social distancing and washing your hands. And if we do that, we will keep this contagion level low.
Thank you.
Thank you.
Thank you, Mayor. Next up is Rosa Flores with CNN. Rosa?
Hi, Mayor. Thank you so much for the opportunity. I wanted to ask you several questions. Mayor Suarez mentioned earlier that Miami was not ready for stage 3, for phase 3. So my first question was, is Miami-Dade in full phase 2?
We're in yellow right now, which means that we're at 50% capacity. And so we have a different system. Red is full shutdown. Orange is what we were for about a month. We proceeded to yellow, which means your businesses can open, but we have to have social distancing, wearing a mask, and then there are limits to the capacity based on there are limits or percentage of your capacity that you can have patrons. And so that's where we are right now. The next phase would be a green phase, which we then allow more activities and we ease up on the restrictions. And then finally will be blue, which is open back to normal, our old normal. So right now we're in yellow, and we don't anticipate going to green for some time.
Okay. And so when it comes to like the phases that the state sets, where would you say Miami-Dade is?
I think we're like in phase 2 right now.
Phase 2.
Something like that. But again, Miami-Dade, Broward, and Palm Beach counties are a little bit different than the rest of the state. And so The governor has allowed us to set basically our own rules down here. And you'll see that Palm Beach, Broward, and Miami-Dade counties are pretty consistent in how they apply the rules. Inside those counties, some cities may decide to do something stricter, but they can't do anything more lenient than what the county allows. And so right now we're in the yellow phase, and the cities can allow certain things that we allow them to have. But if they want to be more strict, they have the right to be more strict.
And given the current uptick, are you considering waiting on moving to the next color, or waiting it out? Kind of what's your take?
Yeah, we're look. We move to the next phase when we feel comfortable that we can move to the next phase. Right now, we just started yellow maybe 2 weeks ago, and there's different aspects of yellow. So even in the yellow category, some businesses were allowed to open earlier than others, and there's still some businesses in Miami-Dade County that are not allowed to open. Bars are still closed, nightclubs are still closed, but a lot of the other businesses now can open. But even some businesses that are being allowed to open have to give us their plans, and we have to approve those plans in order before they open up. A case in point would be bowling alleys or casinos. Even though they're allowed to, individually, they have to submit their plans before we give the okay.
I see. And then finally, I wanted to ask about the agricultural communities. When do you expect those communities to be tested, and what type of resources is the state helping you with to make sure that those communities receive the resources that they need?
Yeah, speaking to the governor this weekend, he indicated to me that actually they had gone to South Dade, and they're seeing they're now testing the migrant population, and they're seeing that there are issues in the migrant population. So there may be either some migrant populations up in the central part of the state that are showing pretty high numbers with testing positive to COVID-19. So obviously requested of him to do that here. We will dig deeper into the numbers of these tests, because we have thousands of tests being conducted here in Miami-Dade County every day. I mean, up to 9,000 tests a day are being conducted here. And so we need to dig into the numbers and see of that, how many were in the migrant community and how many of the positives came out of the migrant community. But we expect, because of the nature of their work and the nature of how they live, that you're going to have if COVID-19 is down there, which we suspect it is, then you're going to see a higher percentage in the general population.
And by when would you expect all of that to be done? Or did the governor give you a sense of when? I didn't get a sense of that, of when that was going to be completed. That's something that we're going to have to talk to our local health department to see when they're conducting those exams, and when they think they'll be finished with it. I believe I got information that from our deputy mayor that they have been in South Dade recently, and they're going to continue to be in South Dade. Am I right, Jen?
Yes, sir. They're partnering with CHI to be able to do some more testing in South Dade, and also deploying mobile units down farther south so that we can make sure that testing is available for everyone.
Yeah, yes. And those that don't know the geography of Miami-Dade County, South Dade is where the migrants are. South Dade is where our agricultural community is.
Thank you, Mayor.
You're welcome.
Thank you. I see Daniel Chang wanting to ask a question from the Miami Herald. Daniel?
Can you hear me now?
I can hear you. Yeah.
Thank you, Mayor. I appreciate you taking the question. Hey, you were talking about the need to look behind the data so that we can understand it a little bit better. And I know that you've addressed some of those questions here. We want to know where the increases are, if there are particular demographics that are being hit. I was curious, if you're concerned about the messaging. We've reached out to the Department of Health locally to see if they could come to the phone and talk to us to understand this a little bit better. But they're really not. And so the messaging that people are getting right now is that the state is reporting this increase in numbers over the past week. I realize that there's more testing going on, but I also see that a lot of people sort of aren't taking this seriously. So my first question is about the messaging. that the public is getting, and whether you feel like the county and the health department are coordinating it well enough to get the point across to people. And then the second question is maybe something that's a little bit more detailed for Deputy Mayor Moon. And I wanted to understand the numbers that you put out on the daily dashboard, the moving to a new normal, and why there are differences between what the state reports and what the county reports. But I'd like to hear you answer the first question about the messaging.
The messaging, look, we have a good relations with our Florida Department of Health here in Miami-Dade. The messaging, look, part of the messaging that we have is that we have more positives, and then everybody's kind of freaking out about it.
Yeah.
The number of positive tests I think we have now in Miami-Dade County number around 20,000 officially, but we know because of our blind study that we conducted at the University of Miami about a month ago, that there are at least 200,000 people here in Miami-Dade County that tested positive to the antibody. Right, and so the more testing you're going to do, the more folks you're going to find. I mean, that's 1/10. The official number is really about 1/10 of the number of people here in Miami-Dade that have the virus. That's why I keep harping on, you have to assume everybody has it. You have to assume that you have it, because most of the people that have it don't have any symptoms. And so that's why social distancing is such an important aspect. That's why keeping your 6 feet. That's why wearing a mask. That's why wearing washing your hands is so important, because the official numbers is only a tip of the iceberg of the number of people that are actually positive here in Miami-Dade. The good news is that most of them will never go to the hospital. And the good news is that most of them are not going to have a significant medical problem. The bad news is that it hits the elderly, and then it hits those with underlying medical conditions extremely hard. So we need to protect that. We need to protect them, but they also need to protect themselves. And so that's the messaging. And I don't want to create any panic in the community. I've been very consistent in saying, look, we know there's a whole bunch of people here that have had COVID-19. We have to wear masks, keep social distancing. That is the consistent message that we've had here in Miami-Dade County. And so, that continues to be it. There are differences and there are nuances in these numbers that you need to dig into and find out, why did that happen? Is it just because, hey, now this virus is starting to escalate again, is starting to have some kind of, a second wave coming? But look, we didn't have that big peak to begin with. And so we do have a second wave. I don't expect the second wave to be, to get above 10%, 11% or whatever. And I never expect the second wave ever to exceed the capacity of our health system to take care of it. And so, I understand the frustration, but we do have pretty good communications with the Department of Health. And I think we've been pretty consistent in how we have to deal with this pandemic. What's the second question? I'm sorry.
It was we've been trying to reconcile the numbers between the Miami-Dade moving to a new normal dashboard and the data that the state puts out. And there's always some differences in there. This might be a little complicated. If we could talk offline, I'd be happy to. But it's one of the questions that we've been asking and haven't been able to figure out yet. And so
I think what we can do is hook you up with Jennifer, because she keeps our dashboard and why our numbers are different. We know that our deaths are different. I mean, the state actually has a higher death rate than we do. Our death rate is based on the actual people that our medical examiner has examined and determined that COVID-19 was the cause of death. Right? Remember, there are people that had died that don't die because of COVID-19, but had COVID-19. Right? Okay, and so you could have a heart attack and die, but if you had COVID-19, even though it had no symptoms, okay, and maybe the state puts that as a COVID-19 death, right?
Right.
And so our medical examiner doesn't do that. He says, no, the cause of death was COVID-19. No, the cause of death was a heart attack. And if the cause of death was a heart attack brought on by COVID-19, that's going to be classified as a COVID-19 death. So that's one of the reasons we think that the death rate by the state is higher than what we have. And it's due to how we classify COVID-19 death.
Okay.
Thanks,
Mayor.
And Jen, afterwards, you and Daniel, I guess, can chat about the differences between our dashboard and their dashboard and what causes that.
I would really like that. Thank you.
Sure.
I'll connect the two of you. Okay, I think that was our last question in English. Did everybody who wanted to ask a question in English get their question into the mayor?
Patty, if I could ask one more.
Okay, go ahead. Andy?
Okay, this I think would be for Deputy Mayor Moon. NBC6 said earlier, one of the days, 76 patients, according to the dashboard, were admitted. They didn't say that 134 were discharged. My question, though, about that is that that's obviously a negative difference of about 60 patients. But on the dashboard where it says total admitted patients, it doesn't reflect those 60 patients. So those numbers are always off. And I'm trying to get a better understanding of how to read that. Is there any answer to that?
What we have found when looking at these numbers is that it depends on what time each hospital is reporting the information. There's a deadline that they must report by, but they report at different times during the 24-hour period. We've also found that hospitals will bring someone in and they won't stay overnight, and they'll be brought in and discharged. And sometimes that seems to elevate the number of discharges. I've gotten the question before, how can there be more discharges than admissions? And that's because the discharges are people who have been admitted at any time prior to that day, while the admissions are the admissions just for that day. And then finally, another complicating factor is that the number that is in COVID patients admitted can be somebody who was already in the hospital and then tested positive. So they were admitted. When they were admitted, they weren't counted on the admissions because they weren't positive when they came in, or they didn't know they were positive when they came in. They were tested and then subsequently moved over into the category of admitted COVID patients. So there's a lot going on. And that's also why, as Mr. Chang's question, there's a lot of issues that have to do with timing and categorization that make it different.
Well, I appreciate it. That makes it better. And just one more question for the mayor. You said you're not going to the increase in cases, and not the positivity rate, but the increase in cases is going to make you say, okay, we're going to shut things down. But what are you going to do about opening places up? Are you going to continue moving forward with places opening up as long as they send in a plan that's approved?
Yeah, on those categories that are approved to open, yeah, but I'm not moving forward yet on some of the things that are not approved, like bars and lounges, okay, and nightclubs. Those are really problematic because the nature of the business is you don't stay away from each other, right? Social distancing at a bar, social distancing at a nightclub, okay, that doesn't work very well. So that's the reason why, those are going to be more problematic. But those particular groups of businesses that we say you can't open, but you must open this way, we'll continue to do that. New categories, probably not for a while, but those, yes, we will be able to do that.
Thank you, Mayor. Now we can go ahead and move on to Spanish.
Okay. Buenas tardes. He visto algunos reportes en la prensa sobre el aumento en casos de COVID-19 en la Florida y quiero que todos quede claro. Primero, como he dicho desde el principio, con más pruebas van a haber más casos positivos, pero más casos positivos no quiere decir que hay muchas personas graves. En este momento, el número de las pruebas en la Florida es lo que más se ha hecho desde el comienzo de la pandemia, así que están haciendo mucho más pruebas ahora que antes. Pero el porcentaje de casos positivos en el condado de Miami-Dade sigue suficiente estable. Al mirar los números que publicamos todos los días en miamidade.gov, pueden ver que el promedio de 14 días es en 7.8%, el promedio de porcentaje de positivo en todos los casos, las nuevas pruebas. Y eso sigue por debajo de nuestra meta de 10%, que es la recomendación del CDC. Y ahora estamos haciendo pruebas a todo el mundo que las pides, y eso incluye a los niños de más de 12 años de edad. Desde el principio he dicho que el número que tenemos que vigilar bien de cerca es cuántas personas están en el hospital. Y esos números también siguen estables, a pesar de un empuje grande para hacer las pruebas a todos los grupos de alto riesgo. Hemos visto que el número de personas en el hospital ha aumentado un poco. Eso es porque se están llevando a los pacientes de los nursing homes a los hospitales rápidamente. El número de muertes sigue bajando y en este momento. La realidad es que no estamos viendo un gran aumento en el número de casos. Lo que estamos viendo es la gente trabajando, visitando los gimnasios, saliendo al parque o a la playa. Y todos estos lugares tienen reglas en lugar para la distancia social, las máscaras y los grupos pequeños. Sabemos que las protestas de las últimas semanas han hecho difícil la distancia social, pero hasta en estas situaciones vimos que la mayoría de las personas llevaban máscaras. Y además estaban afuera en el calor y sabemos que la transmisión del virus en el calor es más difícil. No vamos a cerrar la economía de nuevo porque los números de pruebas positivas cambian un poco en solo unos días. Lo que vamos a hacer es asegurar que todos están siguiendo las reglas. La policía va a seguir visitando los negocios. Estaremos en los parques y en las playas. Si alguien ve que no están siguiendo las reglas, llama a la policía al 305-4-POLICE. Otra cosa importante es que quiero decir es que la orden de más seguro en casa sigue en lugar. Si tiene más de 60 años de edad o si tiene una condición de alto riesgo, quédese en casa lo más posible. Aunque parece que la mayoría están siguiendo las reglas, vamos a seguir mirando bien la situación. Si empezamos a ver un aumento en casos en el averaje de 14 días, vamos a hacer lo que es necesario. Pero por ahora seguimos caminando en la dirección correcta. Recuerden que todos deben de tomar responsabilidad personal y seguir las reglas. Eso es lo que nos va a mantener en un buen camino. Ahora le tomo sus preguntas en español. Patty.
Alcalde, tenemos a Telemundo 51, Yuniesi Ramírez en la línea.
¿Qué tal, alcalde? Buenas tardes. Me disculpo porque no sé qué está pasando con el sistema, que la cámara no me funciona, pero that's okay, no hay problema.
Okay.
Quería preguntarle, ¿puede comentarnos un poco sobre la situación de los migrantes en el área de Homestead y Florida City? ¿Qué tenemos de los números de pruebas que se han realizado? Muchos están indocumentados, muchos quizás tienen miedo de ir a los centros de pruebas establecidos en el resto del condado. Exactamente, ¿qué está haciendo el condado con ellos?
No, el estado de la Florida está conduciendo más exámenes ahí en esa área del sur, el sur del condado Miami-Dade. Sabemos también, hablé con el gobernador este fin de semana y me dijo que el porcentaje en los migrantes es más alto que en la población general, porque en la manera que ellos trabajan y también viven. Así que vamos a hablar con el Departamento de Salud aquí del condado Miami-Dade para ver cuántas pruebas tienen que están conduciendo ahí del condado Miami-Dade y qué han sido los resultados y cómo pueden terminar ese trabajo que es tan importante.
Pero por el momento no hay números sobre...
Todavía no tengo el número todavía. Tenemos que hablar con el Departamento de Salud. Sabemos que están ahí abajo. El gobernador me indicó que estaban abajo en el sur del condado. Estaban conduciendo estas pruebas a los migrant workers que están ahí y sabemos que hay un problema en ese grupo.
Alcalde, su especialista, ¿qué dicen sobre cuándo vamos a percibir o tener una claridad sobre el impacto de las protestas en la transmisión del virus?
Eso puede tomar otra semana. Acuérdate que también la mayoría de esas personas eran jóvenes, así que no esperamos que van a tener, muchos de ellos van a tener síntomas, entonces que la mayoría no van a tener síntomas, aunque espero que ahí recibieron más contaminación cuando estaban protestando porque estaban cerca, se estaban tocando, estaban respirando bastante rápido y eso causa eso ayuda a la transmisión del virus, pero también estaban afuera y el calor también limita la habilidad del virus a contaminar a otra persona.
Mi última pregunta, para finalizar, al menos por los próximos 14 días, los comerciantes, los trabajadores del condado no deberían preocuparse por un cierre, una cuarentena urgente, no al menos por las próximas 2 semanas.
Eso es lo que pienso, pero también nosotros no quiere decir que no tienen que estar vigilantes, no tienen que seguir las reglas. Lo que le deseamos decirle a ellos es que sigan las reglas, usan las máscaras, mantengan la distancia social, lávense las manos, y entonces si todos hacemos eso, no hay necesidad de tomar otros pasos más estrictos. Esa es la última cosa que yo deseo. Yo no deseo nunca regresar a lo que tuvimos con lo que era la naranjada, orange, el nivel orange, a cerrar negocios otra vez. Eso no es nada, eso no estoy pensando en eso ahora. Estamos pensando más en enforzar las regulaciones que tenemos tenemos ahora en efecto.
Gracias, alcalde. Veo que tenemos algunas otras personas participando de los medios hispanos, pero no creo que ninguno tenía ninguna pregunta. Quiero preguntarles antes de terminarlo todo si tienen otra pregunta a alguien en español. ¿No? Okay, Mayor, I think that'll do it.
Thank you very much. Thank you very much, everybody.